Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. Today we're talking about oral chemotherapy and its benefits over the traditional infusion method.
Chemotherapy is medication that's used to treat cancer. And traditionally, chemotherapy was medication that was administered through the vein to a patient in a hospital or clinic setting by a healthcare provider. So oral chemotherapy is chemotherapy that comes in a pill form. So it's medication used to treat cancer that patients take at home by mouth outside of the healthcare setting.
Why the move towards oral chemotherapy?
With oral chemotherapy, there are many oral chemotherapy medications that are currently approved and on the market. And we're finding that those medications that are approved on the market are effective in new types of cancers as well. And likewise, the FDA is approving new oral chemotherapy medications all of the time. And so for these medications, they're convenient for patients as they fit in their daily life and also provide additional lines of treatment that are only available in this oral form.
What are the benefits of oral chemotherapy compared to traditional IV chemotherapy?
Some of the benefits of oral chemotherapy is it's chemotherapy that patients can take at home. So it fits more with their daily life, where they can spend more time at home doing the daily activities that they normally want to do versus coming into the clinic. One of the other benefits too is many of the new medications that are coming out are actually only available in the oral form, and so that they're only available, patients can only take them in the oral form, and they provide additional lines of treatment for patients who are fighting cancer. There are cases where patients do a combination of traditional and IV chemotherapy, intravenous chemotherapy, and oral chemotherapy. And in some cases, it's to help benefit the patient where they have less clinic visits, where they need to come back and see their doctor and spend less time coming back for those additional appointments because they can take part of their chemotherapy regimen at home.
Are there any challenges a patient can face when taking oral chemotherapy at home?
At UMass Memorial, when we prescribe oral chemotherapy for patients, we want to make sure that they have all the tools at home that they need to be successful in taking their cancer regimen at home. There's things like drug-specific calendars that we provide patients so that they can mark off on calendars on when they took their doses to remember and be a reminder system. Patients use their cell phones, so things like alarms can be reminders, and then also there's some newer smartphone applications to help also track medication to take those. And then also at UMass Memorial, we have a wonderful group of staff, including pharmacy liaisons who can help call, as well as pharmacists to help call and remind patients about refills and make sure that there's no barriers to patients taking their medication and make sure that they can continue to take their regimen.
Is an oral chemotherapy prescription available at my regular pharmacy?
Some of the more popular oral chemotherapy medications are available in local pharmacies. But for the most part, patients have to go to what we call specialty pharmacies that specialize in these oral chemotherapy medications. UMass Memorial has a specialty pharmacy on the first floor of the ambulatory care center that helps provide medications that patients can pick the medication up after their doctor visit, as well as mail it out to the patients at their home. In some cases, patients, due to insurance reasons, and the insurance might require they use a specialized mail order pharmacy, which means that the medication gets mailed from a pharmacy outside of Worcester, Massachusetts to the patient's home. Our philosophy at UMass Memorial is that no matter where you fill your medication, we want to make sure that you know everything that you need to know about your medication, you feel comfortable and confident to take your medication, and then also know who to reach out for if you have any additional questions.